Good afternoon, everyone who's joining us on this webinar. My name is Joseph Chebe, and I'm joined by my co-host, Zakia Siboy, and I'll let him introduce us, and then we'll kick off the session.
Thank you very much, Shebe. Welcome all to today's session. I'll be the host today. My name is Zakia Siboy. I'll be the one taking charge of the session, and my co-host will be Chebe. So primarily, just want to give thanks to the people that have joined. So our facilitators from Aster DM Healthcare, as well as the My One Health team that will be joining to learn from this session, as well as our key partners that will be joining this session today. So without further ado, I think we can go through the agenda from Chede, and then we can proceed from there.
Okay, thank you so much, Zach, for that. I just want to take everyone through the agenda that we have. Today, we are joined by one of our partners here at My One Health, which is Aster DM Healthcare. What we are trying to learn about Aster DM is who they are, their unique value proposition in terms of medical treatments within the UAE, the reasons why international patients prefer Aster DM as their preferred medical partners and treatment partners, the available technologies within their hospitals and their clinics, and referral regulations and policies within the hospital and also the broader UAE for international patients. So I'll just let Zach introduce My One Health, and then I'll go over to introduce Aster DM, and then finally our facilitator for the day, Rahul, and then Rahul will take over from there.
Sorry for that. My mic was off. My One Health, primarily, we are a global award-winning health facilitator. We were founded in 2018, and we have a network of over 250 leading hospitals, as well as clinics and wellness centers across 40 countries, and growing aggressively. We have managed to connect close to 50K clients to leading healthcare facilities. We also have an ambitious goal by 2030 to have facilitated over 1 million patients in terms of connecting them to leading healthcare facilities. We also intend in the same period, we would have established a network of over 10K referral partners by 2030, as well as also establishing over 200 leading insurance providers, partnerships with leading insurance providers, just to ensure that policyholders can get access to the required medical treatment or care that they need globally. Our unique selling points in terms of My One Health is primarily our diverse healthcare connection of over 250 hospitals, clinics, and wellness centers. We are also leveraging our technology to ensure that there's that seamless connectivity or coordination between inquiry all the way to the post-treatment care, as well as the personalized patient support that is available within our ecosystem. Yeah, so I think that's primarily it in terms of introduction. I think, Chebe, you can take it over.
Cool. Thank you so much. So Aster DM Healthcare is one of UAE's most trusted and accredited private healthcare groups. They are both accredited by the JCI, and the CAP, with over 1,000 medical professionals across their network of hospitals, clinics, diagnostic centers, and pharmacies throughout the UAE. And today we have our facilitator, Rahul, who has been an expert in international healthcare and medical tourism. He has gone and worked with various international brands, and today he'll be taking us through Aster DM Healthcare. Rahul, welcome very much. It is a pleasure having you today, and we are very excited for you to tell us what the healthcare group of Aster DM has in store for us.
Thank you. Thank you so much for a kind introduction. And thank you so much for organizing this platform indeed. Because I think in platform like this, when there is one-on-one discussions which happens, kind of not only just introduce both sides, the expectations, but at the same time get to know each other a little more because we are widespread in different geographies. I think these kind of technologies that has come in terms of webinars and utilizing these kind of remote learning, cross learning, I think needs to be encouraged more and more. In fact, that is what we are using to try and establish connect directly between our physicians and our partners, physicians and our patients, so that there is no loophole. So I think just timely that we are organizing this. And so you all know that my name is Rahul and I head international patient services at Aster Healthcare. Today I'm joined by some of my colleagues. I can see Reena in the call. I can see Siri. And yeah, so they'll be also on the call in case if I get stuck somewhere, I'm sure they'll be able to rescue me during the question and answer sessions. But then I'll try and take you as much in detail as much as I know about Aster Healthcare. To be honest, this has been my 7th month in this organization. And while I was joining this organization, I knew Aster as just another hospital or a healthcare group, right? And during my orientation sessions, to be honest, after that 7 days of initial orientation, going to different hospitals, talking to different doctors, to be honest, I started calling it Aster World. And I don't know why we do not often call it as an Aster World because it's so much to Aster DM Healthcare as a brand, right? I'll definitely be able to give you some insights during the presentation, but I'll definitely look forward to any kind of questions that anyone from the participants have by end of the session. So let me just begin with sharing this presentation.
Yeah, as you share your presentation, we encourage all our listeners to just keep in the questions rolling as Rahul does his presentation and ask as many questions as possible about the healthcare network.
Yeah. So basically, if I may say that, just a second, you can see my presentation, right?
Yes, we can.
All right. Okay. So Aster DM Healthcare essentially is a UAE, UAE grown company, right? It started with one doctor who's the chairman of the company, Dr. Azad Mopen, and with his vision of starting a primary care unit in Dubai. While he was on his first visit to Dubai, he came here for an entirely different purpose, then ended up starting the clinic with just one doctor in the clinic. And today, after 37 years, the group has expanded, widely across not just UAE but also into 7 countries. Right, our primary presence is in the UAE. However, we also have a significant and growing presence in the other GCC markets of Oman, Saudi Arabia, Qatar, Bahrain, and also India. And in case if you look at in totality about Aster DM Healthcare, it's like right now at present as we talk, and I'm sure these numbers keep growing as we speak. And this is the last file that I had received. So right now we operate about 632 facilities, and I'll be able to explain what are these facilities comprise of. Our presence is in the 7 countries, as you can see, 29 hospitals across India, UAE, Saudi Arabia, Qatar and Kuwait, Qatar and Saudi Arabia and Oman, along with 120 clinics, 371 pharmacies, 114 labs. So this is the expanse of what Aster DM Healthcare is across 7 countries. However, as the company grew along, what we did was that we created 2 entities out of this massive structure that we had. And we saw in India, there was a great potential for further expansion. And GCC was an entirely different world. And that's when the 2 entities was carved out, where Aster GCC was one entity which was looking after Aster UAE and the neighboring countries. And then Aster India was carved out of this entire entity, and that became an Aster India unit, right? So if I talk about Aster GCC, where we are located right now, we have got 10 hospitals in United Arab Emirates, including in Dubai and Sharjah, 108 clinics, 275 pharmacies. Then, as I said, we have got 1 hospitals, 5 clinics and 5 pharmacies in Qatar. In Saudi Arabia, we have got 1 hospitals and 12 pharmacies, but we are growing very, very rapidly there. And every month you will see some or the other. And in fact, we have got some clinics already come in, but those numbers are getting revised as we speak. In Bahrain, primarily, we have clinics and pharmacies. Then in Oman, we have got a very significant presence in terms of large hospitals in Muscat, in Salalah, along with backed by clinics and also pharmacies. So that's the larger presence of Aster GCC vertical. In terms of GCC presence, I spoke about earlier that we had 29 hospitals across our Aster DM Healthcare world, including India. But if you look at GCC, we have got 15 hospitals, 120 clinics, 307 pharmacies, and 120 total facilities with about 17 million patient visits per year. Now, how Aster GCC is structured is Aster DM Healthcare is the holding entity of multiple brands of healthcare facilities, right? So if I can explain that Aster started with its primary care division, which is Aster Clinics, which are present across GCC, and you know, so those are the primary care clinics, multi-specialty neighborhood clinics that you could call it as. Then we have got Aster Pharmacies, which are our pharmaceutical division, which has pharmaceutical outlets across GCC, as I said. Then comes Aster Hospitals, which are our hospital division, and then comes Medcare Hospitals. So within Aster DM Healthcare in GCC, we have got four brands, as I said: Aster Clinics, Aster Pharmacies, Aster Hospitals, and Medcare Hospitals. And how they're structured, I'll be able to explain to you in this slide. So Medcare Hospital is more of our premium brand, catering to our clients who demand a lot of attention, right? In the sense, they not just are there for healthcare, but at the same time, they also seek a lot of attention. They like the services in style, and this is how these hospitals are located and structured, right? So Medcare becomes our premium brand, and Medcare Hospitals, as you can see, we have got multiple hospitals across Dubai and Sharjah. Some of these hospitals are specialized hospitals, like we have got Medcare Orthopedic and Spine Hospital, which has got multiple level of orthopedic and spine surgeries happening in this. So we have got separate team of doctors operating on hip and knee replacement surgeries. We have got separate team of doctors operating on foot and ankle surgeries. Then we have a separate team of doctors operating on upper limbs, arthroscopy, shoulder arthroscopy, ankle, shoulder joints. Then we have got pediatric orthopedic team of doctors who are looking at pediatric orthopedic cases. Then we have got spine surgeons who are looking at not just adult spine, but also pediatric spine cases, including scoliosis. So this particular hospital is super specialized into orthopedic and spine care, backed by a complete rehab unit. Right. Similarly, we have got Medcare Women's and Children Hospital, where we have got all kind of maternity, obstetric, gynecology, gynec surgery happening there, including endometriosis, along with pediatric subspecialties. So anything and everything to do with women and children care is covered in this particular hospital. Then we have got the multi-specialty hospitals aside the single specialty hospital, which are Medcare Royal Super Specialty Hospital, Medcare Hospital Safa, and Medcare Hospital Sharjah. So these hospitals become our multi-specialty outreach, and this is where a lot of international patients, in fact, in each of these units, we see a lot of international patients footfall coming in from different parts of the world. Plus, also, I must in this slide also speak about Wealth as a clinic, which is a unique foray of ours into wellness and longevity space. And I'll give you a little more detail further in the slides. So this is about Medcare presence in terms of hospitals across Dubai and Sharjah. If you look at Aster footprint, again, Aster hospitals primarily are right now available in two locations, in Aster Hospital in Mankhul and Aster Hospital Cases. These are multi-specialty hospital, caters to middle income and upper middle class society of UAE and at large, has multi-specialty work happening, all tertiary care services available in these hospitals. Plus, we have got multiple other hospitals, but not of same style and size. But then these are the two hospitals which receives a large number of patients from different parts of the world. As you can see also that there are other hospitals, including you can see the glimpse of Aster Hospital in Muscat, in Riyadh, in Qatar. And interestingly, with Qatar opening up to the larger world, with Saudi hospital, Saudi is starting to receive a lot of tourists and business people going to Saudi for trade. We have also started seeing some of these international patients covered by international insurance companies coming to our hospitals in Qatar, Oman, and Saudi Arabia as well. And maybe you might also encounter some of these inquiries coming into you for some reasons, while some of these patients have got their relatives living in Saudi Arabia or in Oman or in Qatar, and they would like to choose those hospitals rather than coming over to UAE. So even in those hospitals, we can facilitate the international patients movement. This is just one point I wanted you to note. So that's about our Aster Hospital. Some of the center of excellences that I would want to talk about across our hospitals will be cardiac sciences. So we do have comprehensive cardiac sciences covered from non-invasive to invasive to interventional cardiology, EP labs, cardiac surgeries for pediatric and adult patients. So there's a whole lot of cardiac sciences work for which international patients come to our hospital. Also for orthopedic and spine, as I said in my earlier slide, that we have got a specialized hospital and which caters to very complex knee hip replacement work, trauma work, spine issues, and sometimes we also see cases of redo surgeries, the complex surgeries where the first surgery has failed and the patients are looking for the second surgical intervention. So even those kind of cases, they get referred to these hospitals. Plus, at the same time, as I said, pediatric is another focus of ours, where we have got multiple pediatric subspecialties covered: pediatric cardiology, pediatric gastroenterology, pediatric pulmonology, pediatric neurology, and so on and so forth. So these are some of the center of excellences that we have at Aster Medcare. These are just yearly numbers that we see, the larger numbers that you could see in very surgical oriented, work that we do across our hospitals. So some of those numbers across neurosurgeries, cardiovascular surgeries, although in terms of Africa or in terms of Indian subcontinent, these numbers might still sound low or, might not be so big. But then when you look at UAE or GCC as a market, I think these are significant numbers. These are pure surgical work in tertiary care, quaternary care level. Going to the next slide. Okay, this is a very unique thing that we have with one of our centers. Medcare Royal Hospital has a gene therapy department for primarily for neuromuscular disorders, where we provide gene therapy for SMA and DMD cases. SMA, as you know, is spinal muscular atrophy, and DMD, Duchenne muscular dystrophy. So for these conditions, we have gene therapies, which are novel therapies, although the cost of the therapies are very, very high. But I think for these two disorders, these are the only two therapies, gene therapies available for a definitive treatment. Otherwise, these are very complex disorders. If not treated, I think only leads to fatality over a period of time. So we have a significant presence in terms of gene therapy. The number of patients that we have treated so far, we take lead in the entire region. We could be one of the largest, in fact, in the entire world in terms of the SMA patients that we have treated. We have treated, as I said, 150 plus patients for SMA and around 10 patients for DMD so far, which is very significant numbers because, as I said, these are rare disease. These are not very common disease, and the treatment options available for the patients are primarily in 3 countries: US, Germany, and in the UAE. And Medcare has taken the center stage in offering these therapies. For the last 5 years, we have done a significant work in this area. And here I must stop and say that post this call, possibly I can share, a little more descriptive documents or brochures or materials, including some testimonials and videos of each of these hospitals and the work that we do in these hospitals, so that it could be spread to the larger audience and somebody who could not join in for this session. Moving on. Okay, so this is another initiative of ours. Primarily, right now, this has presence in the UAE, Oman, and Saudi Arabia only. But this is a unique thing that we have used, in our across our hospitals and for our patients. This is our, app which is called My Aster app, which is very widely used in UAE and Oman and Saudi Arabia for video consults, booking appointments, pharmacy deliveries. However, at this point in time, it is only restricted to these locations because this is where we have got our clinics, pharmacies, and hospital presence. But at least we are trying to see in case if we could at least roll some parts of this to our international patients, at least the easy access to lab reports, connecting with the doctors and teleconsults and payment. So these are the three modules that we would like to have for our international patients in this app, and we would like to extend these services as well for our international patients, so that becomes easier to carry records. It becomes easier to book an appointment with our doctors and have a teleconsult while they're away. At the same time, it is easy for them to make the payments sitting at any corner of the world. So we are looking at that angle, and I'm sure that we'll be able to achieve this in very soon. So that's about our app that we have. Something that I left for later in the presentation, Wealth Clinic that I was talking about. And this particular clinic is into functional medicine, is into longevity and wellness space. It's a very unique concept, consists of not so routine healthcare or allopathy healthcare as we practice in a day-to-day healthcare space. We have got chiropractic, chiropractic happening here. We've got a nutritionist in this, psychologies, natural aesthetics being practiced, Chinese medicine, which is another growing concept around the world, is also being practiced here. Ayurveda, which is one of the Indian allied health science, is also being practiced here. So this is one of our clinics called Wealth, which is into, as I said, wellness and longevity space. Moving forward, something about our international patient services. So we have the dedicated team looking after international patient services coming to any of our hospitals, be it UAE or wider GCC, including some of them also doing their travel plan to India. So some of them, when they think that they would not be able to come down to UAE for whatever reason, sometimes visas could play a spoil sport, sometimes cost. Then in case if they need our support in reaching out to our hospitals in India, that is also something that our team provides. Obviously, starting with medical second opinion. So we have got a dedicated query management team where the inquiries come in our system. And these are the people who then looks into inquiries, looks into the specialties for which the inquiry is being shared, the kind of work that we do across hospitals. They know which specialist would be able to take this inquiry. Then they redirect that inquiry to that specialist, connect with them over call, emails, and try and build up a case for treatment, along with packaging the entire response to our facilitators, to our patients, including the cost of treatment, length of stay, profile of the doctor, profile of the hospital, inclusion, exclusions, and so on and so forth. Plus, at the same time, this very team organizes the video consult between the patients and the doctors in case it need be, because sometimes there are too many email communication or WhatsApp communication before patient makes the decision. We try and reduce that time by organizing video consult with any patient who would want to do that. Of course, that needs to be done as per the availability of the doctors, but we try and do it as fast as possible. Of course, we do provide visa assistance to some of these patients who would need. Although UAE visas are very easy to obtain, but at times for certain nationalities there could be an issue, and we definitely have a complete visa support from our system, where we could provide a medical visa to any patients who would like to come to our hospital for a longer stay. Of course, airport transportation, we provide airport transfers through our cars, through coaches, through ambulances, and so on. We also do pick up our patients at times when they are flying in an air ambulance. We do organize airport to our ambulances to go inside the tarmac and receive the patient from the tarmac itself. Hotel reservations across our hospitals, we have got tie-up with hotels of different categories. So in case if a patient wants our support in that, we definitely do provide such kind of support by guiding them the kind of different hotels that we have in a particular hospital. And obviously, then there is a to and fro transportation between the hotel and a hospital, which is organized by the team. Language interpretation, we do have larger languages covered in our system. We do have Arabic, English, Russian, Turkish, and French translation support available in our system. Of course, needless to say that we have the entire scheduling of appointments, admissions, discharge, and all of that support available within the system. International insurances, larger international insurances are covered, which are widely spread across are covered. But at times we also do work with some insurance companies who work on GOP basis in case if they do not have a direct tie-up. That is something also that we try and do. Post-discharge formalities, follow-ups, keeping in touch with the patient, connecting them with the doctors in case if there's a need. All of that is done by this patient, by this international patient services team. Plus something that we've started, that we would like to one person to handhold these patients when they come. We do not want them to talk to multiple people. So in each hospital when they come, we try and introduce them to one person who becomes their shadow during their stay in the hospital or during their stay in the UAE. So they only talk to one person who organizes it all for them in case if it is a logistics need, if it is trying to talk to a nurse or a doctor or whichever kind of request that comes to this particular person and then gets addressed. So this is all in all what I had to say at large of the larger scheme of things that we have at Aster DM Healthcare. I think now I would stop here and let the audience maybe ask some questions if they have.
Oh yeah, thank you very much. That was quite precise and very much to the point. Yeah. Honestly, it was very, as much as it was brief, it was very enlightening about what Aster and Medcare have to offer.
I
Just
can
a
tell you
point.
in case if you give me a little longer, I can keep talking the entire afternoon, but I don't want to bore all of you, right? So this is, because I did not want to just talk myself, but I think I also wanted to hear from people who are listening to this conversation and
Yeah.
what questions do they have for us? Yeah.
Okay, yeah, no worries. Definitely, I can ask in a few questions coming in from the audience. Number one is for UAE, the number of surgeries that you guys are doing and handling as a healthcare group is quite outstanding, because for India, they have high numbers, but for UAE, what you guys are doing is like very at the top of the UAE market. So it's quite commendable. Would you mind taking us some of the technologies, and especially for laparoscopic and minimally invasive procedures that you have, some of the technologies that you have, maybe if the machines or something of the sort? Yeah.
Yeah. So we do use a laparoscopic technique for most of our general surgeries, oncology surgeries, and the same time for orthopedic surgeries. So we have our robotic systems through which we operate on orthopedic surgeries, as I said. At the same time, we also have robotic systems for operating on general surgeries and oncology surgery, as I said. So laparoscopic is something which is very widely used. And as a step forward, as I said, we do use robotic systems to operate on orthopedic general surgeries and oncology surgeries at the moment. So that's on our laparoscopic and robotic surgery side. At the same time, what we do is that's on the general surgery and orthopedic side. But on neurosurgery side, we do have very complex set of surgeries happening in our system. We do have deep-seated tumor surgeries happening, complex craniotomies, spine tumors, scoliosis. So that's on the neurosurgery and spine surgery side. As I said earlier in my presentation, that in orthopedic space we do have redo surgeries happening, the complex redo work, because most of the cases, the patient gets operated, and at times when the implants get infected, that's the time when they start looking at some of the very specialized centers. So we do operate on very complex redo work that we do. Apart from that, oncology surgeries, yeah. So we do have best oncology surgeons. We do have general oncosurgeons with regards to gastro-oncosurgeons, uro-oncosurgeries, gynec-oncosurgeons. So we have got organ-specific oncosurgery work also happening at our different hospitals. Now, what happens is, because of our enormity of presence, because we have got multiple hospitals, our query management team tries to to understands the need of a patient, and then tries and guides them to a particular hospital which has got an edge in a particular specialty, right? So we do have a center of excellences across different specialties in different hospitals. So our cardiac sciences work happens at Aster Hospital, Kese. So that's where it takes lead. Our electrophysiology lab is in Medcare Hospital, Sharjah. Our orthopedic and spine larger work happens in Medcare Hospital of Orthopedic and Spine. Our larger pediatric work happens in Medcare Women's and Children Hospital. So we have got specialized units, if departments, if I can say, which are spread across different hospitals, and that's where our query management team, which has got the entire knowledge of which doctor operates on what kind of cases, which hospital has what kind of departments available, and that's how they work with the partners and the physicians, the patients and the physicians, to respond to their inquiries. Yeah.
Okay, thank you very much. Speaking of oncology treatments, do you offer alternative modalities for treatment such as radiotherapy, brachytherapy for oncology patients?
Okay, very good question. So in oncology space, right now we offer medical and surgical oncology only, but we work with a local partner who has both radiotherapy and brachytherapy. And it's obviously we know that it's a teamwork, right? So
Yeah.
it's a teamwork, and that is how our clinicians have formed a forum where they work very closely. However, right now, as we say, we do not have radiation oncology within Aster DM healthcare space. But we
Okay.
definitely are striving to achieve one in that very very soon we might have it. But then at the moment we try and work with a local partner who provides these services to us.
Okay, well, for diagnostic purposes, especially maybe oncology and some kinds of ailments, do you have an in-house PET CT machine?
Good question
Yeah.
again. I think yes. So these are two things I must have mentioned, which I feel are not covered in our scheme of things, right? In a larger Aster DM healthcare. So PET CT and radiation oncology work is where we do not have a presence, purely because we thought, it has to work out for us. Like the economy of scale has to be such that it has to make sense for us to have these things. While we have a local partner support, we realized initially that we do not need these two services in our in-house facility because of the space crunch. But while we started and we started looking at a significant number of patients, we realized that we need to have both of these within our system itself, and that's what we are trying to acquire very soon. So right now, at the moment, to answer your question, we do not
Yeah.
have a nuclear medicine, and we do not have at the same time radiation oncology.
Okay, thank you. You mentioned Medcare has a women's and children hospital. Does that cover fertility treatment as well for international patients who may want fertility
Okay.
treatments?
Right now, as on June 2025, we do not have, but there will be an announcement made soon that we are coming up with a full-fledged IVF unit of ours in next
Okay.
2 months' time. So it is like
Yeah.
in the process, just that
Yeah.
we need to acquire the licenses and start the services. So we've got the place earmarked, we've got everything ready for us
Yeah.
to get started. But I think that much time, whatever is required for the licenses to happen, and that's the only time that we're waiting for. So maybe in a
Okay.
month or two, we will have a full-fledged IVF services within our system.
Yeah. Okay. So anytime from November, people who want to make babies just
Maybe
come.
even before that, to be honest.
Okay. Cool. Thank
Yeah.
you. For I know like organ transplants are usually a bit of a headache all around the world, not just in the UAE. So do you offer any type of transplants? Maybe BMT, liver, kidney?
Yeah.
Yeah.
So we are starting with BMT and kidney transplant.
Yes.
Right now, we still do not do that, but as I said, in few months' time. So I must have shared this earlier. We have Medcare Royal Hospital, which
Yeah.
is our latest hospital which got added on to the group, which is a 200 plus bed facility. It's a very beautiful multi-specialty quaternary care center in Dubai, and that is where we are trying to achieve all of these services which are not available in our group elsewhere, right? So
Okay.
as you asked, bone marrow transplant and kidney transplant is where we are starting our transplant program from, and hopefully we'll be able to expand that into liver and heart and lung as well in times to
Oh
come.
yeah, for sure.
Yeah,
That will be amazing. So in the
yeah,
next short while, maybe BMT and kidney will be available.
yeah,
Okay.
sure. It will be available in some time. Yes.
Um, going on over to patient support services, is there a standard fee for telemedicine consultations, or does it vary based on the doctor and the kind of procedure the patient would want? S- Sorry, your mic is off. Okay,
Sorry, sorry.
it's okay. It's okay.
Uh,
It's okay.
so
Uh,
you asked, I'm sorry, I just missed
it's
out. There was
okay.
a
It's
repeated
okay.
call. Yes.
Yeah. For telemedicine consultations, is
Okay.
there a standard fee for all consultations and for all doctors, or does it depend on the doctor and the type of procedure the international patient would want to have maybe before they fly in for treatment?
So for second opinions, to be honest, at the moment, we're trying to not charge our patients because we know that these are genuine healthcare seekers and we do not want them to be charged while they're not sure whether they would want to come to us or to any other provider, right? So
Okay.
essentially, as much as you would, if you ask me, I would never want to charge a patient who is still in the exploratory phase of his search of which hospital to go to, right? But again, in case if we see a huge influx start coming in, then maybe at one point in time we might have to think of starting to charge so that we only talk to a qualified set of people, who are genuinely interested in talking to a doctor. But for now, we do not have any fee structure in place for organizing video calls, for second opinion, for such kind of services.
Okay, thank you very much. For taxi services, maybe between the airport and any one of the facilities
Yeah.
within the UAE, are the taxi services complimentary or paid by the patient?
Yeah, no. So our airport pickup and drop, be it by a car or an ambulance, at the same time to and fro from the hospital to hotel. Each of these are all complimentary services that we provide to our international patients.
Okay. Thank you very much. I don't think we have any further questions unless you have maybe something interesting you might want to add about Medcare or Aster Healthcare as a whole. Yeah.
Maybe if I can ask a question with the larger audience, if we can understand where all are they joining from, what kind of experience that they have with UAE-based hospital, and do they see any kind of challenges talking to a patient, showcasing Dubai as a destination? If any one of them would like to share any of this, because it becomes very helpful for us to keep all of that in mind while we connect with our patients, our partners, right? Because they are on ground talking to the patients. In case if that could be a thing that somebody could pick up from their experiences.
Okay, yeah, before maybe some suggestions come in, what maybe I would like to highlight is the fact that Medcare caters to more of high net worth individuals, and Aster DM cares to like middle class to high income individuals, just to make sure that we cater to different dynamics and demographics depending especially on um, how deep your pockets are. If that's
No, thank you so much for highlighting this point, to be honest. But then at the same time, uh, we have got this flexibility, right? So not just the price point, we have got this flexibility. Sometimes there are patients who are a little more cost conscious and they say that, okay, we would like to come to UAE, but maybe Dubai seems to be a little more on a higher side because the stay, food, logistic, everything is a little more costlier. And that's when we try and guide them to our hospital in Sharjah, because obviously there is significant savings that you can make in case if you stay in Sharjah and do your treatment. And at the same time, we have also started encouraging some of our patients who would like to go to Oman or in Qatar, because that's where they can have a very significant saving in terms of the cost. And as a last resort, if they definitely want a very base cost, then we guide them to our hospitals in India. So any of this, we've got multiple category of hospitals across different locations, and we can cover these while we talk to a patient.
Yeah, I guess price point is one of the biggest conversations that we usually have between us and the patients. And the fact that you have told us that teleconsultations are usually not paid for by the patient, so that decision-making process of whether they want to attend treatment
Yeah.
in one of your hospitals, I guess that will really help in moving the conversation forward
Sure.
much as quick as possible. Well, you mentioned that you will be able to send in some more marketing materials that you may
Yeah.
have, and then with this, I believe we can be able to send them over as well to our referral partners and anyone willing to check them out, so that in case they have like any more questions, they can usually have some reference point or anything.
Sure, we can do that over a shared drive. We can
Yes.
share with you a link which everybody can access, and there could be some videos, brochures, and anything to do with our marketing materials that can be accessed there.
Okay, yeah. I do not see any more questions streaming in. I guess it was quite thorough and quite well put out. So I'll just close down the Q&A session for us, and then I'll give it over to Zach to give us our vote of thanks and then close the session. But from my end, thank you so much, Rahul, for taking the time. Very well explained. And yeah, the partnership between My One Health, Medcare, and Aster DM is quite exciting.
No, we are very much looking forward to taking this to a next level. We've just started, and our profile is just now live into your systems, and we are very much looking forward to doing some extraordinary work with you. Very
Okay.
confident of that. Yeah.
Thank you.
So
Thank
much
you.
for organizing this call. Really appreciate it.
Thank you. You're welcome.
All right. Thank you so much, our facilitator, Rahul, for taking us through this session. It has been quite comprehensive. We've actually learned a lot in terms of your network services together with your local partnerships to cater for specialized treatments. We've also gotten to learn about the app and the well clinic that you have in place. And so much thanks to your team, the team that did not speak, that is behind you. Thank you for presenting such comprehensive presentation to us and our partners. I'd also want to thank our partners that managed to join this call. We do hope that this is more assurance that we have the right partners in terms of the hospital network and in terms of best interest for the potential clients that you have in the future, as well as solidifying your trust in all the hospitals and all the brands that we have partnered with to ensure that there's quality healthcare at the most affordable rates and competitive, of course. And of course, finally, I also give thanks to the My One Health team, those joining to learn more of partner hospitals, and as well as the team that organized this session. I give you much warm thanks for this, and we know that there will be further sessions from the Aster team for us to interact more in new services or new enhancements that will come up, as well as more interactive sessions with even a bigger team in terms of partners that will be taking part in these sessions. So thank you so much, everyone, for joining this call, and we look forward to the next session, as we also look forward to.
We must do it again so that we can give
Yeah.
you a little more updates on where we have headed towards, right? So I think this is not just the first and the last session. I think we must keep having such sessions so that we can keep apprising you of the work that we are doing and the updates that we have from our side.
Awesome. Looking also forward to the shared drive so that at least even our key partners can even have more comprehensive insights via the drive that will have the marketing material and brochures from your team.
Very much. Looking
All
forward
right.
to it. Yeah.
All
Thank
right.
you.
Thank you so much,
Thanks, Zach.
everyone.
Appreciate
Thank you.
it.
All right.